everyone. I'm really pleased to be here, and for those of you who might think I turned up to the wrong meeting, my history with drink and drugs is working with people with drug and alcohol problems in primary care over in Telford and Wrekin for about the last 20 years. And so tonight I want to talk about primary care. My background is actually, I'm a social worker by training, but I very much worked in the model that Andy was talking about in terms of an integrated model in primary care with social care as well, which is certainly a great way forward. But I want to talk about some of the policies that both John and Alison were talking about, how that has directly affected us here in Shrewsbury. About 2 miles away, Whitehall Medical Practice closed about 3 weeks ago. So why did it close? Whitehall Medical Practice, really popular medical practice, fairly small, but growing rapidly. It had increased its patient list by around 1,000 within a year, I understand. And it's in an area where there's a lot of housing development, so the population's going up. And when the other GP surgeries heard about the possible closure, several of them wrote in and said, we can't cope with taking on additional patients. Please don't close this surgery. There was a strong public campaign. It was really popular surgery. There was a really good public campaign against a closure. It rated good with the CQC, unlike many of the surgeries that are close by that the patients are now being asked to register with. So why is Whitehall Medical Practice shut? Well, you have to go back a little bit in time and see that the original contract for this surgery was as a walk-in practice. So it's a walk-in surgery with a small GP surgery attached. And the person who won that contract was an organisation called Malin Health, who were represented over in Telford and Wrekin. I'm not sure they still are now. Now, Malin Health has its headquarters in the Bahamas. It doesn't pay any tax, or very little, and in fact there's been a lot of questions raised over the years about their accounting processes. And so I'm imagining it was able to put in a really attractive bid against perhaps other local providers, and it won the bid for the walk-in centre as well as the GP practice. Now, when the CCG decided that they were no longer going to have the walk-in service, Malin Health decided they no longer wanted the contract, because despite the fact that they don't really pay much tax, they need to keep their shareholders rich, basically, and the walk-in centre was the profitable bit of this contract. And so they decided to walk away. They weren't interested in a smaller GP surgery, even if it was growing. And so you think, well, okay, well, it's an attractive prospect, so in should come the CCG, and they should help to find somebody else for this contract. And it's difficult to know whether it's disorganisation or lack of will, but that is not what happened. Basically, there was a big rush, and I think due to perhaps some disorganisation about not realising that the contract was due to be renewed sooner than they realised. The whole process for retendering, which should normally take about a year and a half, was squeezed into about a 9-month period. So there was no real meaningful consultation. There was no real effort put into this. And then the actual contract that they presented was a very short contract. They actually acknowledged that a 5-year contract would be unattractive to providers. The final contract they put forward was 4.5 years. They also added on a contract to deal with patients with a history of violence across the whole of Shropshire into this small contract. And this is not an attractive thing for many surgeries to take on. And so you have to wonder why they ended up getting no bids for this service. And I mean, sadly, if you look across the country, these smaller practices, which are patient-focused, which meet the needs of the local residents, are closing. They're closing down. If you have a look at a publication called Pulse, you will see every week another CCG is closing down a practice like this. And it's sadly, I mean, I do accept that CCG are under a lot of financial pressure, but they would rather have a large practice, perhaps like mental health, who can provide what they see as a cheap service, and they don't. That's what they're focused on, really. It's very much feeding into privatisation of our health service. It's moving away from local provision, and these large companies don't care about providing a good service for us. Their bottom line is about making profit. And so that's just a local example, and sadly these are going to continue to happen, of what's happening in primary care. And I would just like to echo what the other speakers have been saying. I mean, I think firstly, not to get too downhearted, because there are some amazing things that campaigning can do. And I mean, I think Jill will be up talking about what Defend our NHS Shropshire has managed to do, but we must continue to hold people to account. And I think we can genuinely have some effect in slowing down some of these changes. But ultimately, what we need is a national change. I mean, our MP has hailed Future Fit as somehow a kind of success for Shrewsbury, which is quite sickening, because clearly not only does it ignore Telford and Wrekin altogether, but it ignores the fact that one A&E is going to have to try and cope with both Shrewsbury and Telford and Wrekin's patients. But clearly, so we need to continue to oppose these cuts, but we clearly need a new government, because this current government is not, the NHS is not safe in their hands, and they are going to continue to wreck it unless we make some changes. So we have to keep campaigning, we have to keep defending services we have, and we have to continue to hold people to account,